Good day everyone. For today's video, we're going to talk about drugs acting on skin and mucous membrane. Skin is the layer of usually soft, flexible outer tissue covering the body of a vertebrate animal. Its main functions are for protection, regulation, and sensation. Mucosa lines the inside of organs and cavities throughout your body. It lubricates and protects these organs and cavities from abrasive particles and bodily fluids, as well as invasive pathogens. Adsorbents and protectives inactivates the irritants by binding to them. Adsorbents act by binding gases, toxins, and some organisms to prevent exposure to the damaged skin surface. Protectives providing an occlusive layer of protection from the external environment or by providing mechanical support to the affected areas. Subclasses are number 1, dusting powders. They are generally inert and innocuous substances. Number 2, mechanical protectives provide an occlusive film and mechanical support and are popular vehicles for many drugs. Next, we have the demulsions. They are generally high molecular weight compounds that are water soluble. Their function is to alleviate irritation, primarily involving the inflamed or injured mucous membrane. They form a protective layer over the irritated surfaces. Examples are glycerin, propylene glycol, and etc. Next, we have the emollients. These are mild fatty materials that are frequently used to soften or wet the skin. They are primarily used when treating skin conditions resulting from water-soluble irritants and airborne bacteria. They are applied topically. They soften the skin by decreasing transepidermal water loss or transpiration and increasing the hydration of the stratum corneum. They are used today as vehicles for many lipid-soluble drugs. Examples are vegetable oils, animal fats, and hydrocarbons. Next, we have the astringents. They are applied topically. They precipitate protein, toughen the skin, promote healing, and dry the skin. Styptic when used to coagulate blood and cause a somewhat unpleasant sensation when applied to tiny open wounds. Other astringents are of vegetable origin, most of these preparation owing to their activity to tannic acid. Next is the GI mucosal protectants that protect the intestinal mucosa from irritation by producing a protective barrier, neutralizing irritants, or absorbing them. Example, we have the kaolin, activated charcoal, and bismuth carbonate. Next, we have counter-irritants. These cause hyperemia in an attempt to reduce pain and promote healing of tissues beneath the skin after application to the skin surface. For chronic inflammation, it will cause an overriding acute inflammation with a great increase in vascularity and an increased blood supply to the area. An increased blood supply is equal to greater concentration of blood-borne anti-disease factors. There are three stages of counter-irritation that are distinguishable. First, we have the rubefacient action, only mild irritation and a little increase in congestion, to make red. They are more commonly used in veterinary medicine, mainly due to the difficulty in applying the heat source for extended lengths of time. Kaolin poultice is a method of applying heat to a localized area. Medications are iodine, camphor, and methyl salicylate. Number 2 is the vesication. Severe irritation damaging the capillary system, serous exudate. This is the origin of the common name for the vesicant dressings, the blisters. The medications are mercuric iodide and cantharide ointments. Third, we have the pustulation. Great damage to the deep layers of the skin, commonly have pus. The ability of regeneration is lost and scar tissue is formed at best, cause permanent blemishes. Medications are strong ointment of red iodide of mercury and cantharidin ointment. Next, we have the keratolytics, keratoplastics, and anti-seborics. Keratolytics work by releasing keratin, allowing for easier desquamation. Keratoplastics try to normalize keratinization by inhibiting DNA synthesis, and basal growth is slowed. Anti-seborics makes an effort to modify the skin sebum production. Example is salicylic acid. Next, we have the caustics and escarotics. Caustics, also known as corrosives, are chemicals that after one or more applications destroy tissue. Escarotics, also known as cauterizers, are corrosive and will precipitate proteins, causing a scab to form and eventually a permanent scar. Examples are silver nitrate, glacial acetic acid, and antimony trichloride. Silver nitrate, phenol, and antimony trichloride frequently used for removal of warts, same with glacial acetic acid. Antimony trichloride, the compound has been used as an ingredient of debodying preparation for calves. Next is skin disinfectants, functions by removing or reducing bacteria on the skin, which are useful in pyoderma treatment. The agent used include those used for skin disinfection prior to surgery. Examples are povidone iodine, chlorhexidine, and etc. Next are antibiotics and antibacterials. Antimicrobial medication is frequently required as part of the treatment of pyoderma. Treatment needs to be prolonged and relapse is rather common. Some cases, local topical treatment. In severe lesions is systemic therapy. Next is corticosteroids. They are commonly used to treat skin disorders in animals, inflammatory modulators, and more effective when used with antibiotics or antifungal medicine. They are indicated for the treatment of many allergic dermatoses, notably allergies, contact dermatitis, and etc. There are precautionary general guidelines should be followed. Be sure of the diagnosis, use the least amount of steroid to achieve the clinical effect, use the least potent steroid to achieve the clinical effect, choose the route of steroid administration according to the type and severity of the lesion being treated. Classes of medicated applications. First is we have the ointment. It is a semi-solid preparation that usually contains drugs used to treat dermatologic disease. Next is poultice, a soft, moist mass of materials applied locally to an affected area. It reduces inflammation and relieves pain. Next, we have pastes, absorptive powder placed in a gelatinous base, usually petrolatum or hydrophilic petrolatum. It acts as a sponge to absorb exudates and moisture. Powders are used for the delivery of topical drugs to the skin. It's used for control of external parasites and to deliver antibiotics. Next, we have the dressings, external application of some compounds on an application device such as wrap or sterile gauze to protect the skin lesions from external environmental trauma. Plasters, similar to dressing, however, they are attached to the skin via some adhesive materials. They protect skin lesions from external environment and provide an occlusive environment. Next, we have the suspensions, two-phase system composed of a finely divided solid that is dispersed in a liquid, usually water. They are not utilized to any great degree in veterinary dermatology today. Lotions are powders dissolved in a liquid, usually water or an alcohol. They tend to be cooling, drying, and somewhat mildly antipruritic. That's it. Thank you for listening.